The NHS is under very significant pressure. There are over 21,000 people in hospital with coronavirus right now, and we can see the impact that this is having. The threat to life from this virus is real, and the pressures on the NHS are real too. The new variant means that 3/4 of the population are now going to be in Tier 4, and almost all of the country in Tiers 3 and 4. And I know that Tiers 3 and 4 measures place a significant burden on people and especially on businesses affected. But I'm afraid it's absolutely necessary because of the number of cases that we've seen. But where we're still able to give places greater freedoms, we will continue to do so. These changes will take effect from 1 minute past midnight tomorrow morning.
Good afternoon, everybody. Today I want to begin with the good news, the approval of the Oxford AstraZeneca vaccine, which is a fantastic achievement for British science and which will allow us to vaccinate more people and also vaccinate them more quickly. And there's one important development that's helping us to accelerate our vaccination programme across the whole of the UK. We've had new advice from the Joint Committee on Vaccination and Immunisation that the first dose can protect people against the worst effects of this virus because the benefits kick in after 2 or 3 weeks. And so from now on, we will give a first dose to as many vulnerable people as possible, with the second dose to follow 12 weeks later. And what that means is we can vaccinate and protect many more people in the coming weeks. I know that everyone watching this will want to know when you can get your vaccine. And all I want to say is that we are working as hard and as fast as we can to get the supplies to you. And as soon as we have the supplies, we'll be getting them into people's arms. To summarise where we are, we have to face the fact that we've got two big things happening at once in our fight against COVID. One's working for us and one working against us. On the plus side, we've got 2 valid vaccines and we're racing, as I say, to get them out. On the downside, there is a new strain of the virus which is spreading much faster and surging across the country. And we've seen a 40% increase in cases in England in the last week alone, almost 15% more patients in hospital, more than at the peak of the first wave. And yesterday, sadly, we recorded almost 1,000 deaths across the UK for the first time since April. We must face the reality that the sheer pace of the spread of this new variant requires us now to take even tougher action in some areas. And that does affect schools. And let me set out for you what this means. In most of England, primary schools will still reassemble next week as planned for the new term. But in the areas we've just published today on gov.uk, I'm afraid the start of the new term will be delayed until at least January the 18th, when the latest data on those infection rates will be reviewed. And that is because the rate of transmission in these areas is so high, and there's just such pressure on the local NHS that extra action is required to control the spread of the virus. The children of key workers, or those who are considered to be vulnerable, will still go back to primary schools from next week, wherever they live in England. And they are not affected by today's announcement. In secondary schools, all vulnerable children and the children of critical workers will go back next week across England as originally planned. But we will ask exam year pupils in secondary schools to learn remotely during the first week of term and return to the classroom from 11th of January. The remaining secondary school pupils, i.e. non-exam groups, will go back a week later. That is from the 18th of January. But I want to stress that depending on the spread of the disease, it may be necessary to take further action in their cases as well, as I say, the worst affected areas.
So you can see unfortunately, it is a pretty grim and depressing picture at the moment. The situation in the UK is precarious in many parts already, particularly the southeast and London, and it is almost certainly true that the NHS has not yet seen the impact of the infections that will have occurred during mixing on Christmas Day. And that, unfortunately, is also rather sobering. So given that picture, I just want to say, look, I know New Year is coming up. I know it's normally a time of great festivity and enjoyment, but you have just got to play your part now in bringing us back from this very dangerous situation that we find ourselves in.